Testing. Testing. Test. Testing. Testing. Can you help me with one more check? Testing. Test. Test. Testing. Testing. Yeah, can you go in there and just do test?
Testing, testing, 1, 2, 3. Testing, testing.
Okay, that sounds good. Can you hear me?
Yes.
Okay.
Yay. Okay, I just put the thing on.
Okay.
Real quick, did you want me to hold these back there and see if these, like the visibility? Just a reminder for the speakers.
Actually, that's perfect. Yeah, we were thinking for in person. Yeah. Someone asked a question in the audience? Wow, 16. Okay. I'll take it around.
Oh. Should we do it in the middle?
Yeah.
Okay. And I'll do it. Yeah, I kind of.
For the smallest food, the 12 houses on Circle. Yeah, we love it. We've been very lucky. Yeah, so there's 12 houses and there's 5 of the 6 that are. So we just got a couple of they look like they're
Okay, we should be good to go. Any questions on the text of it?
No, it's not. And there's a one. Oh, that's what it is. We do not like this.
I knew we had a curse.
Perfect, yes.
Is it on?
Is this yours?
No.
Is this yours? Okay.
Is it on? Testing. No? Is it on?
I can hear it by my laptop.
Okay.
Technically, putting this on reduces. I recommend just having it off, but what do you think? Parker usually puts it on, but I take it off. So, this is better. We can hear you. I can hear you from my laptop. Okay.
Okay, you got one? Okay.
I feel like
Hi, Doris. Hey, Chuck. Don't forget to send your suggestions by Friday so we can start putting the lineup for the next seminar series.
I did have speakers which were, I mean, we had one which was canceled because there was a town hall meeting and they postponed her.
Okay, yeah. So you have one.
That one was the company, but it was my second one. The second one,
All right, well, we're sure to.
no, she didn't either. Both of my students lost, my speakers from last time, I said, I still have to actually seminar.
No, so we'll try to reschedule them for next year.
Was one from Legacy?
From Legacy? Okay. All right. Well, I'll talk with Parker. Make sure that they're on the books. Matt, don't forget to send your suggestions for speakers. 2 at least. Because, otherwise you have to present, so, yeah. Twice, yeah. Let's give 2 more minutes. Atmospheric scientist? Wow. Exposures. Certified industrial hygienist. Por ejemplo, wow, ya, súper legal. Te felicito. Qué bien. Hello, everyone. It's 12:01, so we're gonna get started. Um, Thank you for coming. My name is David Hurtado. I'm an associate professor at the Institute, and I'm hosting, and I'm excited to introduce the speaker of today, Dr. Diana Ceballos. Diana is an assistant professor and the director of Exposure Equity Lab in the Department of Environmental and Occupational Health Sciences at University of Washington. She specializes in environmental and occupational health and safety, exposure assessment, science translation, and the implementation of community-engaged public health interventions with a focus on high-risk, understudied populations. Diana is a chemical engineer and atmospheric scientist, exposure scientist, certified industrial hygienist, educator, and worker advocate. Dr. Ceballos has published 47 peer-reviewed articles, numerous non-peer-reviewed articles and science blogs, 3 book chapters, and 21 government reports. I am personally very excited to have Diana here because she's a fellow Colombian working in this in our field. She's from a different city, though, a better city than the capital of Bogota. No tariffs because she's at UW, so we didn't have to pay any importation tariffs, so we're good. And no, but more seriously, I think the reason I'm very excited is because Diana, and I don't want to get too existential, but a scientist like Diana is the one that is under threat right now, an international scholar who's coming to America to work for the American workforce. So we're delighted that you're here, and yeah, so please welcome Diana.
Thank you, David. So good afternoon. Thank you so much for being here. Is everyone hearing me okay? Okay, good. So today we're going to talk about the burden of unregulated toxic nail products in nail salons. I'm very interested in this topic because nail polish and other nail products touch us on a more daily basis, even beyond workers. And nowadays, even all genders use nail polish, if you see probably in Portland. And so it's a very relevant topic. Also, I think with this year, with the push of no regulations and things like that, FDA has primarily not regulated things like nail polish. And so there's a lot of space.
Okay. Thanks very much. And I was told...
Ryan?
No, I have muted Ryan.
He muted. Okay. Awesome. Okay. I have an audience, right? Very exciting. So there's, a lot happening in the federal government, and I think the sad thing is there's all these initiatives about safer alternatives around the country that are ongoing, and I hope that they continue to go. So I do believe that it's a very relevant topic. And so briefly, because part of the idea of coming to Oregon is because I moved to UW only less than, almost 3 years ago. And so I am a UW alumni, but I want to sort of reinvigorate my research in the Pacific Northwest. And so one of my purposes is for you to know me and that I would love to collaborate. And I know many of my colleagues already work with Oregon, but because I'm new, I'm still kind of making roots. And so I want to share a little bit about myself, about my research program, and hopefully resonate some potential collaborations in the future. And then going to nail salons, about the nail salon industry, and a nail salon pilot study that I did when I was in Boston, when I met David a long time ago. Okay, good. In industrial hygiene, it's actually, very different to epidemiology, where you have 1,000 of data points, right? Industrial hygiene is more like the very in-depth evaluation of a workplace. And so often, I used to work at CDC NIOSH for 5 years, and we would go to 3 different workplaces in the same industry and would probably publish a paper just from that. And so even though this was a pilot study, you will see that it's not a huge study, but we produce a huge amount of work and results that are very informative for what's coming to the industry. And so I'm going to mention briefly different toxic groups that we investigated while doing this work on solvents, fragrances, SBSCs, which are like plasticizers and flame retardants, and trace metals, and then some conclusion and discussions. And so briefly, David already talked a little bit about myself, but I was curious what word cloud would do with my CV nowadays. And again, environmental occupational health just really pop up. And so even though I do focus on workers, I do extend into the environment all the time. I have done air pollution for some time, and I'm also very interested in hazards that displace to families, which just this morning, it was like talking to folks that work in that realm. So that was very exciting. And so the way that I describe my research program is in the intersection of exposure sciences and health equity. And I, throughout my career in academia and government, I see 3 themes that are, I do exposure assessment, but I'm also very interested in creating new methods and new techniques, and then translating that and doing intervention and education. And I know this institute cares a lot about interventions, so I thought that was also very interesting. In the past, before UW, I have worked a lot with the small businesses. Again, dirty jobs, high-risk workers, low wage, precarious employment, things like that. And even though I have worked in many, many different industries, from past before coming to UW, these 3 groups of industries are some of the ones that are more, I've devoted more of my time and energy to study, which are nail salons, which we'll be talking today, electronics recycling, which is a very new industry in the States. When I was at NIOSH, I did a study on metals and flame retardants, and I was one of the first ones to bring the study of flame retardants to the agency, which was very exciting at the time because there have been a lot of studies elsewhere, but not in the States. And then I ended up doing also some educational work. There was a need for learning more about how to prevent PCB exposures in these workplaces because many of them had a ton of PCB waste in transit, even if they were not equipped to deal with it. And so some best practices. And when I was at NIOSH, I was working with a lot of industrial hygienists, and the normal thing to do any lead investigation was to use these colorimetric wipes that were developed by NIOSH. But lo and behold, there was no literature about them. I'm like, this is a precious tool. All industrial hygienists in the world should know about this. And so I made sure that that was published in the literature. I mean, there were some articles from the development of the technique of laboratory control experiments, but not in the field. And so we created sort of some best practices for how to use the wipes. And I've continued to use them both in research and teaching. They've been a great teaching tool. And so if anyone is interested, I'm happy to chat. I developed a guideline, and I'm actually going to be talking about these wipes tomorrow at the Pacific Northwest AIHA Symposium, if any of you are interested. And so some of the other work that I've been doing is with lead-exposed construction workers and the preventing hazards that go into families, and lead-poisoned children, unfortunately, often happen as a result. And so I used the wipes that were only used exclusively in occupational settings, but in the home of workers. And they were extremely helpful. They bloom very red in the presence of lead. And even kids were very like, oh, that's a big no-no. And so they were very great educational tool. And we developed some motivational interviewing and action plans for families to prevent lead in the homes. More recently, these are some of the newer projects since I started at UW, and I just wanted to briefly mention them in case anyone is interested. And so I am working with King County Health Department in safer degreasers and an intervention, evaluating the intervention before and after. Just my student was presenting this morning at the Pacific Northwest AIHA Symposium about it. And we developed also some educational materials, since many of these workers are not familiar with these hazards. In fact, some of the workers were using no label uses of the degreasers, like even cleaning anything, and they were super highly exposed, unfortunately. Eyeliners, I don't know if you've heard the work from King County. We're just very close to publish a paper, but they basically have pure lead as eyeliners still in commerce. And Afghan communities were particularly vulnerable because they put eyeliner in their children. And so that's been beautiful work. We developed a better XRF method. Now I'm working very deeply on consumer products of all kinds, including pots, and specifically on Teflon and PFAS. And we developed, we're going to be publishing a report in June for the legislature with a new method to measure with a portable XRF the fluorine as a tracer for the PFAS, so that we can do better screening for enforcement and other things. And we educated a lot of communities and gathered their input in terms of what was a priority for us to test. And then the last one is an NIOSH R21, which may be slashed, I hope not, but very likely, on solid waste workers, and it's in landfills and sorting stations, because I did a lot of the electronics recycling. A lot of the e-waste is also going to other parts of the solid waste. And when you look at the literature, it's mostly biohazard and safety. And so looking at how toxic our garbage are getting. And so even the municipal landfills are a toxic, soup. And so looking at that, and in terms of novelty, because I'm very interested in flame retardants, using this new technique, which is a sea-air ban, which is very similar to the OSU ban, but just a little different, refined, very specific to flame retardants, and comparing it to standard methods that are used in occupational settings. Okay, so let's just start with nail salons. I'm gonna go very quickly. It's mostly just to share some of my research and spark interest in different topics, but I'm happy to answer questions at the end. So as you may have heard or seen, there's nail salons often, depending on the neighborhood, on every corner. It's grown exponentially in the last decade or two, partly because of the Vietnamese influence, the refugees, and the upbeat in Asia of nail polish and nail techniques. And so there's now a big workforce in the United States of nail technicians. And these technicians can get certifications relatively easy. So in fact, a lot of new immigrants actually take on these jobs, the same as electronics recycling. And so it is a very interesting field. And for my dissertation, I actually did work with spray painting in auto body shops. And one of the things that was very interesting for me to research nail polish was that nail polish is looking more like car paint and every day. And so we know of all the hazards in auto body for a while. And so one of the questions that I had was like, are we now going to be transferring those hazards to nail industries? That's an interesting question. And then it's also like the artificial nails, right? You have acrylic that has always been an identified hazard in dental offices, but now transferred to something that is, much less controlled probably than even a dental office. And so to understand nail polish, it uses a lot of solvents, and it always uses a plasticizer, a resin, and then all kinds of elements and other additives to give color and finish. But when you see of the disclosed ingredients of a nail polish, sometimes SDSs can be 10 pages long. It's actually very interesting. There are some ingredients that are diamond, like they crush it, I guess, to give shine. It's very interesting. They have like this bizarre ingredients. And so besides nail polish, you have a ton of other products, of course. And then these have to be very neat, kind of clean and ambiance environments. So they use a lot of cleaning products and a lot of fragrances to make it feel like more of a spa. And on top of that, there are small businesses. They're very focused on the bottom line and creating a profit. And so they're not knowledgeable always on health and safety, mostly female and young and immigrant, low education, English proficiency, limited training, and exposed to a multitude of chemicals that even, government agencies are not even aware of what to recommend. And so these are just a lot of layers of vulnerability. And traditionally, if you go to a nail salon, there's just not a ton of controls. Obviously, Washington State was one of the first to do nail research like 15, 20 years ago. And they created some of the first ventilation regulation, and that has translated around the country. But at the same time, and they were using masks even before COVID, so they were even more prepared for COVID than other workplaces. Some of the small businesses that opened first in the pandemic, but still, there's just a lot of, because they're very consumer oriented, they don't use a lot of controls. There's definitely limited research. There's many reasons for that. This is a very transient worker population, immigrant. They may not even speak English. They may not be in the typical databases. The codes that are used can be service sector. Like there's very difficult to track. There's been now some papers on health more recently after they thought about it very hard, and one including from NIOSH, which is great work, but it's only mounting basically the literature. And one of the reasons I started doing this work was because when I was working at CDC NIOSH, it was 2015, and the New York Times expose on nails came out, if you may or not recall. It was a 3-piece talking about almost the slavery because New York had a booming on nail salons, and they basically buzzed people in and out of New York City from very far where they actually were afforded to leave. And so they work in horrible conditions, working many, many hours a day in very high exposures. And so these journalists actually won many awards, very well deserved, reported a lot of health concerns. So of course the New York Health Department, which is actually a very good health department, was very freaked out. And so they started doing a lot of work, but they called NIOSH for technical assistance. And so I was in the team that was going to be deployed to go to the New York. But at the time, for different life reasons and everything, I decided to take a job at Harvard. And so I moved to Boston. And I didn't end up going to the health hazard evaluation that was going to happen in New York City. But I knew what they were going to do, and it was fairly limited. And so it gave me a great motivation because there was so much lack of research in this topic to do more. And so I started this study right after 2016 and 17. Again, only 20, up to 20 nail technicians, depending on the measurements that we did. We sometimes gathered 10 or 20, but we took 2 years to collect the data. It was a lot of work. 7 to 12 nail salons, and sometimes we would go, twice to these salons. They worked full time, and it was mostly nail, not hair. We did a lot of things. I'm going to go through it very quickly, but for the most part, my goal was to learn what they were exposed to. So I tackled different groups, chemical groups, and depending on the chemical group, if it's volatile, you want to measure the air, but if it is something that is not volatile, you want to measure, for example, a surface. So depending on what I was doing, I measured different things, but in general, you had external exposure like environmental things, and then also inside the workers, so biologicals. But then I also did nail polish samples to understand potential sources. And we did ventilation measurements and also observations and a survey of the workers. And so these were actually fairly stable, the ones that participated. In the profession, work full-time. This is a typical worker with one of the passive samplers that we did for measuring VOCs. That was fantastic. Normally, and previous research has done active sampling that had limited number of VOCs and very limited detection. And we also did silicone wristbands. These were small salons. Most of them did mani-pedi. Only one of them didn't do acrylics. Of course, we didn't find acrylics in that salon, which was a good way of, doing an intervention. And then most of them worked almost all week. So these were, people that were heavily exposed to these chemicals. Only 2 salons had something like local exhaust ventilation. In Boston, this study happened right before they did some ventilation interventions at the government level. And so it's likely that if I did a study now, they will probably have more. But you can see this one was working very well because the dust is being pulled in, which was good. But as you would expect, many of these salons are in street malls. Right? And so many of the street malls are not designed for having an industrial operation. So the ventilation system is more of a residential. It's designed really for an office. And so the ventilation was really not even meeting the adequate indoor air quality recommendations that ASH raised more for thermal comfort, but it still is like the bare minimum. There was some use on personal protective equipment. It wasn't huge, but that was not surprising. And then the results. So here, solvents. For those of you that are not too familiar with chemicals, volatile organic chemical compounds include solvents, fragrances, personal care products, building materials, and cleaning products. So they're not only coming from the nail products, but they, in essence, they evaporate at room temperature. There's a lot of health concerns associated with them. And so overall, we found that the volatile organic compounds peaked with procedures. This obviously was not surprising, but it was important to document. It peaked at very high levels as well. And, volatile organic compounds were correlated with more ventilation in the sense that if you had more ventilation, the volatile organic compounds were less. It was not as statistically significant because there's a lot of variability. We had a few shops, but it was still encouraging for intervention results. In terms of the air results on solvents, we definitely had the highest for acrylates, which is not surprising. And then 2 of the main solvents that turn out to be high in quantity as an ingredient of nail polish. And in particular, one of the key findings was finding so much toluene, and it's actually been part of some of the new legislation in California and Washington and other places to reduce toluene in nail polish. Now, we study blood with collaboration with the CDC and CEH laboratory that does the NHANES, the national baseline understanding of chemicals in our body study. And we confirmed that these workers were definitely more exposed to the general population. And you can see that the changes of both the most abundant solvents, which are toluene and ethyl acetate, in the blood increase across the shift for most of the workers. If not, it stayed the same, but you have to understand some nail salons sometimes didn't have many clients that day. So this is one worker, pre and post shift, one worker. So these are likely workers that only had one client that day or something like that. And so from this study, we found that basically nail products are contributing to VOC work, to exposure to VOCs. None of these workers were exposed beyond regulation, so it's not like they can be cited or anything, but it is definitely contributing to the burden of exposure. And VOC ingredients in these nail products are being seen in the blood, which is confirmation that it's not just in the air, immediate air environment, but also in the workers. And so there's definitely more policy and enforcement to reduce some of the bigger culprits in these solvent groups. And these things are already happening, which is encouraging. So now the most recent work was fragrances that we published recently. You're probably familiar with fragrances. If you go to Macy's or some of these perfume shops, you get overwhelmed. And so sometimes that happens with nail salons. And so we were looking at personal inhalation and potential sources. And just to give you a mini brief on fragrances, there's a lot of them, and it includes both natural and artificial chemicals. And so what is interesting of fragrances is that we found that they were used in many different things and not just the personal care products. And we found of 55 that we measured, we found 18 compounds, which is, again, not too surprising, but it's still pretty shocking. And we found two groups of chemicals that were interesting because they were the highest, alcohols and terpenoids. You know, they want you to smell, so it's probably from cleaning products to smell clean and fresh, right? And so, but it was a big list of fragrances that were in these workplaces. But it was exciting because it was one of the first times that we focus on fragrances in these workplaces, and it can really contribute to nervous system health is an issue, like headaches and fatigue and all these things. And so it can really contribute, even odors alone. We found that the main sources were nail products, but also personal care products and cleaning and air fresheners, which are things that you can intervene about. So as a brief summary, a subset of scented chemicals in nail salons do contribute to the total burden of VOCs in these workers, but there's a lot of future research that is needed because we know so very little on fragrances. There's actually some research looking at the benefits of in your well-being of fragrances. I don't know if you're aware, but I'm doing cannabis research now, and so I'm learning all these things, and terpenoids are added to the cannabis things as good things. And so, it's just a very complex topic. But there's definitely need for policy for at least disclosing ingredients. Like many times we just couldn't even, you just see fragrances, right? And so Washington State, the new legislation, because they're doing safer products for Washington, it was just enacted last year, and ecology is working now. And so there's a lot of momentum, and that's why I want to revitalize this work. And so the Washington regulation in California, I think, is enforcing disclosure of ingredients, but we get nail products from all kinds of places, so it's going to be challenging to even enforce that. So now the other chemical group that we studied was semi-volatile organic compounds. They more slowly evaporate into the air, so they linger on surfaces and all kinds of dust and other places. They're commonly used as flame retardants, plasticizers, but they can even be used as fragrances, which is very interesting. And they're found in personal care products and building materials, even beyond the nail products. And so an interesting thing happened is, as an industrial hygienist, if any of you are, you're trying to look at SDSs. That's like in every class we teach about using MSDSs, SDSs for any work project. And so I collected all the SDSs of the nail polishes that we were collecting for the study, and I put a new master student, very bright, to do a review of the MSDSs, and it was mainly to inform my VOC paper. And she came back to me and showed me, like I had mentioned that there were these the toxic trio was very important to note if the nail product was matching that. And so it's basically saying that this nail polish doesn't have 3 bad actors that have been identified in the past as formaldehyde, dibutyl phthalate, and toluene. And so she came back to me and she's like, well, but I'm a little confused. She was so sweet. I'm a little confused because I did not find much of that toxic trio. Like, she thought she had done a poor job. And on top, what she did was she found all these other labels that were happening, and she was like very confused, like, I'm not finding the toxic trio, I'm finding all these other labels. I'm like, oh my God, that's not documented anywhere, because I was looking at all the health departments that had information on nail polish and everything to guide my research, and everyone talked about the toxic trio, but nothing else. And so we worked with the health department in Boston to document these many labels that now exist on nail polish. This was a few years ago. And so that was very interesting because it didn't only tackle those 3, but all these other things. And one of the things that was interesting, which happens a lot, and is that, you know, with good intentions or not, I'm not sure, but when they eliminated one bad actor, they basically put another bad actor because they needed to have functionality, right? And so we were able to document very nicely when that was the case. And so basically informing that some labels are good, educating consumers and awareness of bad actors, but at the same time, it's not guaranteed that your product is safe, really. Yeah, in fact, some of this, there was a shop that was very proud of their safer products, and it was very sad because their nail polish actually had isocyanates, which is much more of a sensitizer than acrylics themselves. But the products were labeled as safer alternatives, and so it was, you know, kind of, it shows there's a lot of work for us in public health. And so to summarize that study, we now know that there's many labels in nail products promoting safer alternatives. And unfortunately, they really only account for things that are intentionally not or added to as ingredients, but not necessarily trace amounts or byproducts and things like that. And sometimes they come across as partial truths, unfortunately. And there's a need for a third-party validation of labels in these products and policy to enforce disclosure of products nationwide. So then, because we obviously documented that there were plenty of these SVOCs in nail polish, we also were looking at the workers. So we did urine and also in the silicone bracelets. And we can see that for some of the many different phthalates, alternatives, and organophosphate esters, there was an increase across the shift. And some of them, like this one, for example, was even higher than what the general population often carries, which is suggestive of occupational exposure. And so it's another chemical group of concern that is in nail products, and we see it in the workers. And there's a need for policies that enforce elimination of toxic ingredients, but at the group level, and finding things that are functional, but that can also be not as toxic. The last one group of chemicals that I looked at was trace metals. And when I say trace metals, it's because, no one is adding, thankfully, in nail products, lead or cadmium or things like that. And I actually say this statement purposefully because I'm doing research on lead in eyeliners, and they do add lead intentionally as an ingredient. So shockingly, to this day, you can still commercially buy eyeliners with lead oxide as an ingredient, or like 98% of the eyeliner. And so that is still happening. We also know from the literature that there's a lot of lead and other metals, like for example, in lipstick and other personal care products. So I was very interested, especially with the change in finishes and things like that look more like car paint, if metals were an issue. And so another thing that was very interesting going to these nail salons is that some of these metal colors are not only on the traditional nail polish, but because when they do acrylics, they also use powders because they need to mix it instantaneously when they're creating the acrylic, or sometimes they put it as decoration on top of the nail. And so I felt that that could go in, and be contributing to the work environment. And so we did a preliminary assessment, and we call it trace elements because we actually didn't find a high concern on metals, on heavy metals, which is good. We definitely found some other metals that were definitely there. And so we did urine in these workers, and we are comparing to NHANES, and there's definitely some of the metals that were studied that were definitely a little higher. And we also did toenails, and the toenails we found especially mercury to be very high compared to all the other studies, and there's no NHANES for toenails. And one of the things that we thought for mercury in particular was that there was very likely possibility for diet, because of the Asian eating a lot of seafood. So no heavy metals were found, which was fantastic, right? There were still some elements like antimony that exceeded guideline and were not disclosed. And so they're likely, they were in high levels, so there were likely combination of things that, become a raw material, and it's not like added antimony, but a colorant or something that has it. And there were certain properties of the polishes, like different finishes or color that carry more of certain elements, but at least it wasn't lead or cadmium, some of the more concerning things. And so a little note on toenails is that with XRF, I worked with a postdoc at Harvard, Aaron Spagt, who's an XRF expert, and we did in vivo toenails. So he basically irradiated the toenail directly. I'm mentioning this because it's actually like for someone with animals, that could be a great use of non-destructive EC reading if you're not yet using XRF. But it was very, very nice. We were able to get IRB too, which I was surprised. So remember the toenails were high on mercury, so we did a confirmation of how much in the chemical those toenails were analyzed versus what it measured in vivo, and there was a very good correlation. So it was very encouraging, but you do need a little bit more on the high end of exposures to be able to capture it, but it's still a good tool, especially if you have a work population that is highly exposed to a particular chemical, metal. And so from that study, the last thing is that I just wanted to do a little pitch for toenails. I'm always telling epidemiologists and people that do cohort studies to hood toenails. They're easy to implement. They're very cheap and easy to store. And now we can use XRF to analyze them. And so it's a little easier than it used to be. And captures longer metal exposure window than other biomarkers. So there are some advantages. So in overall, with all the different studies that I covered, I hope that is a little evident by now that there's just a lot of toxic chemicals still present in nail polish and other nail products. Some solvents is still of concern are the especially aromatic hydrocarbons, which we know can be carcinogenic and neurological issues and other things like toluene. Then we have semi-volatile compounds like phthalates and organophosphate, flame retardants used in these products. It's basically plastic, right? And then some trace metals, but thankfully still not as bad as other consumer products. Many of the toxic substances that we detected were not listed in product labels, and unfortunately in some cases were actually listed as not included, but they were there. And so there's definitely need for better labeling. And hopefully by now I argumented that nail products are definitely contributed to air quality in these salons. And as we saw, some of these nail technicians work their whole life. Sometimes they're intergenerational businesses, so their aunt, their sister, their cousin, everyone is there. Sometimes they even have kids in the nail salon because they don't have daycare. And so there's definitely, a lot that needs to happen for making these workplaces more sustainable and long-term well-being of the workers. Proper ventilation helps reduce levels of these volatile contaminants, especially, which was nice, and that helped a lot. The results of our study thankfully helped a lot when the Boston Public Health Commission was doing interventions on ventilation, although that was a difficult sell at the time. It's interesting in retrospect sometimes what happens, when the pandemic hit. I think all the nail salons were actually really happy that they had implemented the ventilation, even though they resisted it tremendously. And so sometimes there's some unexpected wins on interventions, but it's not super easy. So now this always touches on health equity and why I do this work. Many of these workers have a lot of intersectionality in their social determinants of health, and say a little bit of plasticizer is not going to make you sick that day. It can really contribute long term, and especially many reproductive age, and a lot of odors and vapors that can give you headaches. There's a lot of health concerns in this workplace population. And then on top of that, you want to add all the psychosocial stressors. Sometimes, in Washington, they're pretty good, and in Boston, they were pretty good about pay, but there are other states where they can have a lot of issues with not being paid properly and things like that. And even ourselves, scientists, is still tackling complex chemical mixtures is a challenge. And in particular, in this case, it includes things that are not very well known, like fragrances. And so it's challenging to generate science-based recommendations. And even though, like I said, none of them were above occupational exposure limits, there's still, oops, that's not intentional. There's still enough to cause health concerns. And so thankfully, a lot of ventilation regulations have been triggered. Now some safer alternatives are coming up. But obviously, it would be nice to have something more at the federal government. And there is a lot of work that has been done in Europe through REACH that has trickled down also to help us in terms of chemicals in consumer products, but it's going to be some time. So, future directions. I have a new PhD student that is going to be funded through an Asian American nonprofit this fall. And so he's very interested in qualitative research. And so I'm going to start doing a needs assessment in Washington, doing some qualitative research because my hope is to work with ecology to look at barriers and motivators, how to adopt safer alternatives. We can revisit what labels are happening almost 10 years after. And then because I'm doing the project with PFAS, which we're already doing some cosmetics, I would like to do more nail-related stuff, just because to this day, and who knows, maybe someone is already working on a publication, there hasn't been any papers. And at the time, I didn't study PFAS because it's so expensive. But now that I developed the screening method that I have the XRF paid for and stuff, it's going to be much easier to do. But regardless of you being interested in these specific things that I want to tackle, I would love to collaborate in other ways. And you don't have to go to Washington. It can be data-driven, or I can even come to Oregon to do nail salons here too, or other topics, as I shared other studies in my research portfolio. So thank you, and I guess we'll have plenty of, I rushed a little bit thinking I was going to be too long, but any questions?
So did you do any long-term measures, especially, if they stop working in the major bodies, how long before what's being higher in these workers?
So the question is if I did long-term follow-up of the workers to know if these chemicals stayed in the body. I did not, and it would have been wonderful. Many reasons. I mean, the pilot, I gather a lot of funding to do this work through different small grants, but I didn't get a huge grant. So that was obviously a limitation. But with the VOCs, we tried to go on the day after the weekend so that, the pre-shift would be closest to like baseline. But it didn't always happen because they sometimes work 7 days a week. So that was not non-started. And so that is why sometimes the baseline is high. And so there's definitely some carryover that you can see even with the snapshot that we had. In terms of metals, they reside in the body for longer, so it's very likely they'll stay there for longer. Even if we followed them, it would be likely not lower. For VOCs, if they reduce their exposure, they would probably have some clearing time, but it would probably go down. But many of these workers just don't stop working. It may increase for sure, but I think it would be more related because they don't accumulate in the body for long, more than a month, I think. It would be more production related. Like if they had a huge amount of work that month, their exposure would probably be higher. But yeah, I would love to do a longer follow-up studies, but that has not been the case. With blood also was challenging to do different days, even pinching them twice a day was challenging. but yeah, it would be wonderful. Yes. Can I answer those two first, just because otherwise I may forget? Okay, so she was asking about PPE, and we did look at correlations. I think there were some minor correlations with the data, but we had a small study, so it was hard to go down to those factors. But I do know that, for example, Rashauser, the Harvard study, why they took one of the flame retardants in the, one of the phthalates in the toxic trio was because of a Harvard study. They did just a survey in urine samples, so it was easier than with blood. And so they gathered many more workers, and they were able to correlate with use of PPE. The one thing too is we didn't see a lot of use of PPE. So respirators only like a very small percentage use them. And then for gloves, a lot of them actually use latex gloves, and they're not very protective for solvents. And so I didn't think they were gonna see a lot, but I'm sure there's probably more work being published right now that looks at that specifically, just because I have, I love the translational piece and outreach and education, all of that, but I actually never went there for nail salons. We submitted some grants and we never got funded. But what I did is I worked with the Healthy Cosmetology Committee, which was with the Boston Public Health Commission. And we always did a lot of talks with communities, and they themselves had a safe shop model. And so they disseminated a lot of this information indirectly, but it wasn't something that I led. And so I think that piece, I didn't have as much control, but I produced research that I knew was being used by the health department to produce some guidelines. So for example, in all their materials, they only had 3 free, and after our work, they updated that because they were giving safe shop for 3 free, but then, they updated that. So it was rewarding in that sense, but I didn't get to do that part of the work. So that was the second question. What is the third question? We have time, no worries. It's a good question. So the question is if with the new administration, we may see a decline in the nail salons. It's very possible. I mean, they're talking about taking out asylum and refugee status on many people, right? And so I don't know yet if the Vietnamese have been affected. I do know that is more on the recent folks, but, the Vietnamese community has been established for a while. So I am not sure, but I wouldn't be surprised they're going to be affected somehow. I can tell you about it when I start my needs assessment. Yes, so it would be great to know. Yes. So the question is if there is new products that have safer alternatives, and what do I know about it? So again, the paper on labels was primarily very focused on brands that were marketing themselves as safer. And so, for example, for the most part, the ones that were like above 6 free, they are usually more sort of over the top. They're eliminating a lot of things. And if you go to some of the, at least in Boston, I haven't been to many nail salons in Seattle. But in Boston, because when I was doing the study, there were some salons that really sort of market themselves, and they usually would carry the ones that are 6, 9 free, whatever. And those nail polish are usually more expensive. Again, the caveats are, those nail polish are very likely safer because they often don't have toluene. They often don't have some of the bigger culprits, formaldehyde, that sometimes is even an ingredient. But in terms of the fine line, like they may take one phthalate, but another one, like there's still a lot of, and another thing too, when like I have a daughter, and so when she was growing up, I was doing nails, and I became friends with all the Vietnamese people in Boston, and so they, and I was hyper conscious, and so I bought some of the safer alternatives for kids, and they just fall off with water almost, and so they don't work very well, and so I'm like, well, no wonder they're not as used. I was in conversations with this company that wants to produce no VOC nail polish, and we were even thinking about a grant, and I don't know what happened. But that to say, Washington State, not work I did, but one of my mentors, they did no VOC paint in auto body, right? And so I do know that technology exists, and they're working to create nail polish on that, especially because they knew Washington, California is going to be kind of cracking them on some of these things. I don't know if it's happened. So hopefully when I get my student and I get things started again, I can contact these folks. So I know things are happening. And again, with safer products for Washington, I wouldn't be surprised that that in itself is going to be pushing the industry to work more. The same California law also more recently. Just as an example, because recently I've been focused more on PFAS, and we're doing both bad actors and safer alternatives. So for example, ski wax hasn't been, the policy on ski wax has not gone through, but is on the dock. It's like it's happening soon. And so you can already find ski wax safer alternatives for PFAS, even though the legislation hasn't happened. It's almost like they know. And so it's exciting to see. We don't know what we're gonna find, but at least the products are happening. And so I wouldn't be surprised with these safer products for Washington. A lot more is going to happen and things in California, but we'll just have to see. But those products are much more expensive, like considerably more expensive. And so that is also a drawback. Yes, let's see.
Now, given the funding outlook, is your decision still to continue with nail salons, or would you, if you were only able to study a few different industries, would you go to interested in studying a different industry with higher levels?
So let me clarify something. So trace metals, for example, were low. Heavy metals were not present. That is good. For solvents and SVOCs, even though they were meeting occupational exposure limits, that does not mean they were low. Like they were still enough to cause concern. And so because we know that this worker population has so many health effects, and we know they're exposed to this complex chemical mixture, it's often the case that it's not just one thing that is causing, but it's like the combination of things. So even though it was lower than perhaps other industries, the health effects are there, and these are very kind of vulnerable populations in many layers of income and education and immigration status and other things. So I'm very committed. I do agree that, for example, I was very excited to do more of the biomarker stuff with VOCs and with the safer degreaser study that sadly and surprisingly was actually not still below occupational exposure limits, but surprisingly very high levels. So the data is more exciting, like it has been much more interesting in terms of us pushing what we know about biomonitoring of VOCs, because VOCs was heavily studied in the 70s. And it's almost like nothing's happened. So even though we know indoor environment carries most of the VOCs now, and so that work actually, the biomarker work proved more interesting with auto repair and safer degreasers. And so I am already doing what you're saying. And that is actually why I'm actually excited to work with this student that is interested in qualitative research, because then I'm more focused on the solutions, right? We do know there's some bad actors, that it could be better. It's not the worst, but there's still health effects. How can we help this worker population? But
I mean, I just think it's astounding when you think about all of the exposures that workers face. And
yes.
I love your interest in more vulnerable workers. And there's, I mean, unfortunately, there's so much that can be impacting so many workers. Now we're going to know less and less about that.
Yes.
I think Justin just said there was a hand. Is there a hand?
Hey, just a second. Related to what you said, my friends, the Beacon friends, they're still friends. They would tell me that they were like psychologists to their clients. Like they religiously went every week and they talked for an hour, and it was like a ritual. And so they were like psychologists, marriage counselor, all kinds of things, and they always joked about it. So yes, absolutely, it's more than just the nails. Absolutely, yes. Sorry. So what do we have people in the chat?
Hi, yes. Paul, sorry, Paul, I might butcher your last name, but they had a question. What's known about the permeation of these chemicals through the nail material? Is it more of a barrier or vector? That was Paul's question.
Great question. We know very, very little. That alone would be a research study. We also had that same issue with the lead in eyeliner. There's just no research of what happens when you put lead in your eye. It's very likely more absorbent than the normal skin, but there haven't been studies. And so, yeah, we need Kiesel. I don't know if you remember Kiesel, the professor at UW that did a lot of dermal control studies. I would love to do that kind of study. We just need the money. But thank you. Sorry, I wish I knew. There may be, but I haven't looked it recently. Back then, there wasn't much. Sorry. Thank you.
Thank you, Diana. Thank you all. And do not forget to send your recommendations for the next seminar series. So please send me an email with that. Thank you all. So when is it?